Haley Hawkins. Our capstone is the benefits of occupational therapy in pediatric primary care.
Hi everyone, my name is Haley. I chose to do my capstone project on the benefits of occupational therapy within pediatric primary care. I'm going to hand out my deliverables right now. So, like I said, I completed my capstone project on the benefits of occupational therapy within pediatric primary care. I was fortunate enough to work with a pediatrician's office in Linden, Michigan, called Positively Pediatrics. They serve the Tri-County area. Some background as to like how I got onto this topic was the importance I feel, or I feel like it's very important to continue to advocate for children who need services. I have some family members who advocated really strongly for children in our family to be able to gain the services that they need. And a lot of times parents aren't educated on what the typical development looks like for a child. So by educating parents and educating pediatricians, this was going to help kind of bridge the gap between delayed services for children. So when I was researching the literature, I was able to identify gaps within the practice area, and I found that pediatricians aid in identifying developmental delays to support timely intervention services. However, challenges like time constraints and limited access to screening tools can delay, to identify delays can be impact early intervention services. I also identified that there is insufficient parental knowledge around typical child development, which then therefore leads to parents not bringing up concerns at pediatricians' visits, or just lack of knowledge surrounding what typical development looks like. So after I identified these gaps within pediatric primary care, I began to explore how OT can help bridge this gap. So I made some deliverables. So the brochures that I handed out are brochures that were given to each parent during well visits between the ages of 0 to 3 years old. So some of you have like 2 months, some of you guys have 3 years, 2 years. So for each age range, there's different developmental milestones, and I would bring it in for each age. And then I also provided some feeding milestone brochures as well, because during some clinical experiences, I realized that there was a huge gap within feeding and oral function. So I was able to provide some different milestones for what feeding and oral motor function looks like. After I did this for the 14 weeks, I was also able to collaborate, obviously, with the pediatricians during this time. So one story that actually I was very excited about, and I texted Dr. Paul about, Dr. Perman asked me if I wanted to come in and see a child who was 9 years old. He was struggling in school, sitting still, some fine motor stuff like handwriting and whatnot. And I said, yeah, that I would go in. And like immediately I kind of was thinking like OT brain, like what could be going on. And he kind of let me take the session over a little bit and help identify some barriers that OT would be able to help with in the future. So it was an easy way to kind of bridge that gap between whether the child should be receiving services and having an OT there to kind of be like, yep, this qualifies for OT services. So that was pretty cool. And then I also had some cool collaboration stuff in regards to feeding. Something that's come up, or that came up with a lot of parents, was tongue tie and feeding, and how they would say that their child was making a clicking sound when they were feeding and had tongue tie. So looking further into it, There's a lot of oral motor stuff that happens when you're sucking, trying to receive nutrition. And so when you're tongue-tied, it can impact that. So I was able to make some information for the pediatrician on when to refer to OT, how OT can help with things like this, as well as information for parents on how to kind of compensate and help their child in that aspect. So at the end of each week, I had an email list, and I made an email for Positively Pediatrics, and I sent out a survey. In the survey, it kind of asked parents how they felt our meeting went, how the education went, and then if there was anything more that they would like to receive. So in addition to parents wanting more information on play and learning strategies, which it was a later deliverable that I made, as well as regulation strategies, they, I asked how they felt about all of the education and the services. I reached about 160 parents during this time. Out of the 160, I had 47 parents that fully completed the survey. So some things that I found after running statistics was that 80.9%, so 38 participants reported wanting occupational therapy education in future visits. 95.7%, so 45 parents, reported an increased understanding in their child's development. 89.3%, so 42 parents, reported an increased confidence in their feeding skills. Based on like these results and my experience at Positively Pediatrics, it kind of helped identify that OT education does help support timely intervention services, as well as occupational therapy playing a key role in health promotion and family-centered care. And then help support that expanding OT within pediatric primary care can help support long-term outcomes for children in early intervention services. Some challenges I experienced was probably more so just time. I think that Positively Pediatrics and the pediatricians did a great job at like kind of integrating me and working with me to find like the best way, but ultimately there still is a schedule and amount of time each patient is there for visits. So sometimes I didn't need a super long time for the visit. Other times I could have used like the whole hour. But so I would say that was like the biggest challenge. And then recommendations that I would have would be continuing to provide standardized resources for caregivers and parents so that they kind of understand where their child should be at developmentally and to be confident and comfortable with talking to the pediatrician about it. To promote and integrate occupational therapy into this setting, obviously, and then to increase interprofessional collaboration. I feel that being able to collaborate with a pediatrician was really useful, even though they know, OT, PT, speech, all of that stuff, being able to kind of show firsthand what OTs can do in a setting like this, as well as how it can be beneficial to children in outpatient services was beneficial. And then also expanding access to caregiver education. A lot of parents did not realize that there was, the CDC had developmental milestones laid out, and that there's an app, and it's very parent-friendly. So just making that more known and parents being able to access that more, I think would be a great thing for them. But overall, my experience was really, really good. I am very thankful for Dr. Paul and all of her help and looking through all of my deliverables. And then Dr. Perman, who did show up, for being supportive and working with me and being able to kind of just integrate me in even though you had no idea what to expect. So thank you.
Haley, you were often, I felt, busting at the seams during this capstone, like just ready to hit the ground running. And is there something that you wish you would have put in more in your MOU? Like, would you change something so that you could expand a little bit more than what you did, or were you comfortable with where you were at with this project?
No, so something I had originally thought about and wanted to do prior to meeting with Dr. Perman and his staff and getting my site was to do like a support group or a support program type thing. I would, if I had more time and was able to kind of figure out the legality behind everything, I think that is something that I would do. But with just 14 weeks and HIPAA regulations and trying to figure all that out, that was kind of something that we weren't able to do. But we still had the email where parents could reach out to. The parents utilized the portal very often. So it was what it was for the time and stuff, and I think it worked out. But yeah, I would have added that.
And then one more thing, do you have thoughts on branding yourself, or branding like what you've done and kind of expanding it, because it's clearly still a gap.
I've thought about like going like the consultant route, and pairing with pediatricians to give services. Dr. Perman and I also discussed that there's not a lot of pediatric therapy services within the Linden, Michigan area. So that is a long-term goal of mine. And I thought about the Etsy stuff that you had brought up, but other than that, I don't know.
Question.
Yes.
The statistics that you reported from your survey are quite astonishing to me. I would think that parents would have been much more satisfied with their entire experience at Positively Pediatrics. It sounds so holistic. I wondered if you thought about publishing or writing an article about your experience and these results. I feel like it should be broadly disseminated so people can see how valuable your services were.
I talked with, I think it was Myota, and they were doing like a conference or something. Unfortunately, they didn't have more space, like all of the blocks were already closed. So I wasn't gonna be able to present there. But I've thought about continuing to share and present because it is something that I'm passionate about, and I think that it could be very helpful.
Excellent job,